Matt Geller from optometrystudents.com. I'm founder and senior editor, and today we're here with Dr. Rapp, professor of biological sciences at SUNY Optometry. Really appreciate you coming on. Certainly a distinguished individual, someone we wanted to have on the interview for quite some time. So, thanks for coming on.
Thank you.
Appreciate it. So tell us a little bit about yourself.
Okay, well, undergraduate education at the Venerable City College of New York, graduate work at Case Institute of Technology in Cleveland, chemistry, both bachelor's and doctorate in chemistry. Got interested in photochemistry as an undergraduate, looking at the effect of light on different chemical substances. And then when I got to graduate school, my advisor had a large program, but one of the things he was doing was looking at the effect of light on rhodopsin. So that's basically what got me into the field of vision.
Wow.
And I've sort of been there ever since.
Wow.
And I spent 3 years working at, I worked for a year at the Israel Institute of Technology, the Technion. I spent 2 years at Brookhaven Lab out on Long Island, and I've been at SUNY since 1973.
Wow. Yeah, there you go. So, really we brought you on this interview today to, not only talk about some of the things you've done, but also to focus on the genetic model in optometry and see if there's kind of a place for that in optometry and what that would mean for the profession and, how ODs can kind of benefit from that and help their patients. And so, what is the genetic model and how does it fit into optometry? Tell us a little bit about that.
Okay, well, genetics is being incorporated into medical care in terms of dealing with disease, and specifically in terms, one of the areas and one of the really critical areas is in terms of a pre-symptomatic evaluation. So in other words, being able to intervene before the symptoms actually start. Mm-hmm. So then the advantage of that, of course, is that you delay the onset of the disease, and then once it manifests, you can delay the progression, hopefully, and also decrease the severity and things like that.
Right.
So this is already being done. And interestingly, ocular disease represents really a better sort of venue, so to speak, than systemic disease, because there are a whole bunch of ocular diseases that result from a single mutation in one codon coding for a particular protein, what we call a SNP, a single nucleotide polymorphism,
right?
A so-called monogenic disease. Okay, whereas lots of these systemic diseases, heart disease, hypertension, diabetes, other things, the genetic contribution is very complex. Right. There are multiple genes and multiple sites, and there are all sorts of complications and complexities in terms of applying that to actual clinical care, even though it will be done, but it will take a longer period of time. Gotcha. There are all these studies going on, genome-wide association studies. There's something called the 1,000 Genomes Project. The genomics is already being applied in terms of ocular disease. And my actual epiphany, if that's the right word, in 1995, I read a paper where they were looking at mutations in rhodopsin, which cause retinitis pigmentosa. So one particular site, if the mutation occurs in that area, it tremendously adversely affects how rhodopsin responds to light. Mm-hmm. And then in the other area they were looking at, it does have an effect. It does cause the rhodopsin to respond abnormally, and it does result in disease, but it's not quite as drastic as in the first site. We're able to show this with standard measurements that one would do in a clinical setting: visual acuity, visual field diameter, dark adapted sensitivity, ERG amplitude. Mm-hmm. And I remember when I read this, and this was 1995, okay, 17 years ago, I remember when I read this thinking, my God, this is really going to have a direct translation into clinical care.
Right.
So, starting in 1996, I published 3, I guess you'd call them op-eds or commentaries, urging optometry to get involved in this particular, in other words, starting to set up programs that would train optometrists, those that were interested in ocular disease, to start to use genetics, genetic testing as part of clinical care.
So your warning was out there.
My warning was out there. It has been largely unheeded. There are people here and there, even a few people at our institution that are doing it, but it's not something that optometry is identified with. There are two categories. The first category is genetic testing useful in terms of the things that I mentioned? The answer is obviously yes. Okay, so that's without a doubt. I think everyone would agree with that. I think the second issue is in terms of optometrists dealing with ocular disease. I mean, I go back in the early days when I got here in 1973, optometrists were not even allowed to use diagnostic drugs. Okay, I remember going up to Albany to testify before, I think it was some Senate committee, in terms of the basic, because I was chair of the department at that time, to testify in terms of the basic education that we were giving our students. Did this qualify them to use diagnostic drugs? Okay, and then there were therapeutic drugs. So there's been a whole long battle throughout the country in all the different states, and optometry has managed to incorporate this so-called medical model, for lack of a better word, into clinical care. And people recognize, the public recognizes optometrists as being viable healthcare providers in terms of ocular disease.
Right.
And I feel now this entire thing could be in jeopardy if optometrists don't get involved with genetics. And you know, just to cite a specific example, in 2007, 5 years ago, there were several essays that were written for the major medical and ophthalmological journals: JAMA, Journal of the American Medical Association, NEJM, New England Journal of Medicine, Archives of Ophthalmology, and all of these articles were predicting that, according to some experts, within 5 years, according to everyone, within 10 years, that genetic testing would become part and parcel of a routine ophthalmological exam when someone presented with some sort of ocular disease.
Right.
And so so 2007. So here we are already at the 5-year point.
Right.
It's not a question of you know, if this happens. It's a question of when it's going to happen. Okay, I have no idea when it's going to happen, but it's going to happen.
Right.
Okay, and optometrists are completely unprepared for this. So what does that mean? So let's say at some point that's what the ophthalmologists start to do. You know, in other words, you go in for an exam for an ocular disease, and they will draw blood and send it out for genetic analysis. And optometrists aren't doing this.
Right.
Okay, so in terms of the public perception, what does that mean? So in my mind, it sort of would be analogous to, let's say, you going to your internist for your yearly checkup, and the person not drawing blood to do, let's say, a lipid profile.
Right.
So who's going to continue to go to such a person?
Right. What practitioners are doing this now? You know, which practitioners are actually drawing blood, doing this genetic testing, and helping patients with that? And also, why haven't optometrists embraced it? Is this a political situation, an education, or an insurance type of situation?
There are lots of ophthalmologists that are doing this. In fact, I think just about everybody that's involved in ocular disease in the ophthalmological community is doing this as part of standard care routine. As I said, there are a few optometrists here and there who are doing it, but it's not something that that's recognized universally in optometry. And more importantly, as I said, we're not training students to get involved in this area.
Right.
In terms of the mundane aspects, including insurance, I mean, I think there are three things that are happening that are pushing genetic testing more and more into clinical care, ocular as well as otherwise. One is that the amount of money it costs to do the analysis is coming way down. The second thing is the length of time it takes to do an analysis is speeding up very significantly. And perhaps most importantly, since you mentioned insurance, the insurance companies are starting to cover the tab for the genetic testing, because they are beginning to realize that it will cost them less in the long run.
Right.
So these are all important issues that are driving genetic testing into standard medical care.
Gotcha. Okay. So for students interested in this, once they hear this interview, one of the things optometrystudents.com is trying to do is have a little form, which you should find on the bottom of this page with this interview, where students can sign up and say and show that they're interested in something like this and pursuing this and making this happen in optometry. And so do you think if we have a following of students, a couple hundred, maybe 1,000 strong, that schools and organizations would maybe catch on and say, okay, clearly there's a need for this and people are interested in and would pursue the program and perhaps get that rolling, and maybe in a few years we can see the end result. Do you think that could happen?
Yes. I think the more interest, the better. I mean, one of the things we're doing at SUNY, I've developed a genetics elective, which is going to stress application in a clinical setting. And part of the course is going to be run by a genetics counselor person who will specifically talk about how to incorporate this information into a clinical exam.
So are there any other areas that optometry has not been associated with that might become part of optometric clinical care?
Yes. Another area that I've been very interested in for a long time, nutrition. There's also an elective in nutrition, which is actually being offered for the first time this summer, which basically is going to be geared towards optometrists that are interested in incorporating nutritional counseling into their practice, either doing it themselves or hiring someone to do it. And we're also bringing in a nutritional counseling type of person who's going to talk about things like the psychodynamics of patient care. And it's interesting that you should ask the question because both nutrition and genetics are becoming part and parcel of issues that are important in terms of ocular disease and specifically age-related macular degeneration. So one of the things that has happened just over the last couple of years is some models have been set up which look at a bunch of different factors, including genetics and including environmental factors and diet and nutrition and demographic factors and ocular factors in terms of setting up a model that can predict how likely it is that someone is going to develop AMD, and once it develops, what the likely progression characteristics are going to be. But again, showing you how both these areas are becoming vital in terms of dealing with ocular disease.
Right. Okay. Yeah, I mean, that about concludes it. I really appreciate you coming on. It was an extremely insightful interview. We're going to take this and run with it and hopefully get students on board and, get something started. So, thanks for leading the way and for being so influential in the profession.
Very good. Thank you.
Yep.